Hi, this is Jay from LifeRx, and today we're going to talk about lower back pain. And most dangerous in my practice, it was a spondylolisthesis, and people treat it as a normal spine. This is not good. So today we're going to talk about lumbar area. A lot of people come to the clinic, they start complaining about lower back pain. They just say something. It's really painful up here. I was sitting, now I stand up, start walking. The pain is always present. The most of the time, what the therapists try to do, and they try to release this muscle tension around the spine. And this is not a good idea, because if we have a problem, disc problem, what's the most cases is going to be the disc problem. We release the muscle, which is try to protect our spine to not get more pain. You see what I'm saying? That the muscle is just kind of spasming around. They don't want to feel that pain. So the brain send the impulse, create more tension up here. And most of the time, it's not a good idea to release those tensions. That's why people sometimes complaining about massage, or next day I feel worse actually. And this is not good, because people, they don't know about they have some serious problem with the spine, like the spondylolisthesis or stenosis. And that's why today we're going to teach clients and therapists to understand what's the problem and how to identify this problem. Okay, so today we're going to talk about spondylolisthesis. And what's the spondylolisthesis? It's a 4-6% adults being affected by this problem. This is the spinal process problem. When you most of the time it's in the lumbar area, sometimes in thoracic area and neck. If people sitting all the time in the front of the neck, it's happening in the neck. But usually it's a lumbar area, and most of the time it's when you L4, L5 slide forward. So forward is anterior tilt. Now think about it. If person come in with this anterior tilt of the vertebra, what we doing? We start use our elbow, we push on those QLs, we try to release the muscle, so we push that vertebra more. Or people feel, oh, I feel stretch, I feel good after stretch. Just think about it. If you start stretching this lower back, it's create more inhibition in this disc, and it's create more problem. And sometimes it's several grades in the spondylolisthesis. It's a grade 1 and low grade, which is grade 1 and 2. It's a real minor. It's caused a little bit problem and a little bit pain in the lower back. Sometimes it's shooting down, but it's like I said, minor. You can really work on that. You can create that core stability, those stability exercise, and it's really helped the lumbar spine. But in the high level, it's level 2, grade 2, and grade 4, which is have to be surgery. So it's most of the surgery. Trust me, you have to referral to the doctor. We have to refer them out. If these people come from the doctor with this grade, the high grade of spondylolisthesis, you have to be really careful. You have to really precaution what are you doing, and it's serious stuff. You can seriously injure a person. Okay, so who have it? Most of the people. Sometimes childbirth, like with the deformation of the child, and they already know that most of the time they do X-ray or MRI, and people just live through the life cycle with this problem. Next one, it's athletes. Athletes who use a lot of hips. Most of the time it's a gymnastic people, because they do all those crazy postural stuff, whatever, rolling, jumping, and that can create that spondylolisthesis. So athletes have to be really careful and always check the spine. Football players, yes, a lot. When the punch coming, especially in the lumbar area, it can remove the disc. Remove the disc, and that's really dangerous stuff. We don't want to go down that way. Most of the time, what's the referral? It's a pain referral down your legs, and each vertebra have all different area of the pain in your leg. So we're gonna watch it on our picture. You can see this picture right in here right now. Come up here, so I'll show you.
Yeah.
So come up here. I just show you on the map. I don't print it out. Come up here.
Okay.
So this is we talk about spondylolisthesis and the problem in the spine. When people
Yeah.
feel a referral from lumbar area, that's always below your below your hip. So as you can see on this map, if L5 is shooting right through this glute,
Yes,
right
it goes to
here,
the IT band.
IT bend and come to your first
Yeah.
here. So
Yes.
it's come
the-
right
oh,
this
right,
way.
right.
Okay?
Yes.
Here S1, and you can see S1 is come more like laterally, yeah. It's also L5
They
heel.
crisscross.
So this is really important. I can send you this picture, and sometimes
This is good. Yeah.
yeah, when sometimes people come in and they said I have this.
Oh, the same thing for shoulder.
Yeah.
It's interesting.
Yes, and this is how you find out what's going on. I don't know.
Yeah.
He put C2 so far. Yeah, I think it's
It can affect to that area.
yes. So
Referral.
correct. So this is really important to ask those clients when the lumbar area. Sometimes they come in and they say, "Oh, my hamstring is like really painful, burning all the time. Is that my hamstring?" You say, "No, it could be your sciatica, or it could be your the disc
The clue is burning.
burning."
Nerve is tingling, numbness, pain, weakness.
So as you can see on this map, most of the people, when they come to your clinic for massage, they experience something burning down your hips. It could be the hamstring, it could be the calf muscle, it could be in the heel, it could be on your metatarsal. So always ask a lot of questions. If they've been diagnosed with the lumbar problems, any stenosis, spondylosis, spondylolisthesis, something. It's been any sport injury related but lumbar area, because if something burning and shooting down, it's not just a problem in the specific area. It's not just a tight calf or something ankle mobility. It's always gonna be right in here. Most of the time cases is gonna be in lumbar area and it's radiated down. So just be careful with this. And like I said, do not put too much pressure on the lumbar area. When I started my career a long time ago, one lady comes in and I start manipulate that erector muscle. I thought she's just tight on the erector muscle, and when I release it all the time, she feel pain, and that was the spondylolisthesis. It's my first time I met spondylolisthesis. But I'm great. I'm just like, I get this kind of attitude. I want to learn what's happening there, and I will start learning about that. Spondylolisthesis, yes, when I push too hard, I push on that spine, not in the spine, the erector muscle, but when I release it, people feel pain, sharp pain, and it's go all the way down. And I'm glad I did. I called the person, I sent her to the doctor. She of course, she's not done anything. Yes, she just thought it's a pain, like a lumbar pain, because she's sitting a lot or tight. So I refer to the doctor, they do a x-ray, that was a spondylolisthesis, low grade, and of course she go through the physical therapy, and I hope she's doing good right now, so I think she still remember me. But this is like, the video is all about ask questions. Ask questions, just don't start helping right away, and don't try to help in one day. You try to make person 100% back in one day. It's not gonna happen. You have to take your time, you have to create a treatment, and you have to go this way. Now we're going to talk about a little bit symptoms. Most of the time, like I said, it's a spasming in the muscle, like a hamstring, also back stiffness, difficulties to move, difficulties to jump, and pain when you're bending forward most of the time. And we're gonna do the test right now. It's gonna call Stork, and this is really great test for the spondylolisthesis. And you feel weakness or person feel pain, that's red light for treatment. So let's start do the test. So the first test, what I'm do, I just see how person shift the weight and if any bending forward. So we're gonna put the foot together and look at those big toes and try to touch your toes. She's a yoga person, so I want to see if she's shifting. So you see, she's kind of bent to the side this way, and she's not rounded. So she's completely like a little bit flat up here, a little bit bending up here. Any pain present?
No.
And she's not shifting weights a lot. So she's supposed to shift weights to the back, okay? But this is the test, the Stork test. We're gonna stand up on one leg, just see if she's okay here. You don't experience any pain. You don't need to go that high. Just right, just right here, kind of. Do you feel any pain?
No.
I just want to see any balance, any hip problems here. Now you're gonna switch the legs. Do another one. Just see how she can stay. After you stay in the front, she's a little bit wiggling up here, maybe problem up here, you see, in this hip. All right, so now we're gonna do Stork test for the spondylolisthesis, and what she's gonna ask, she's gonna lift the leg up again, and kind of back towards me, back up towards me. So yep, she's kind of lean on me. If any pain, I let her know I'm here, and you go back. Is any pain? Okay, let's switch legs. Same thing, I'm just here, no worries. I'm holding you and let it go. Is that any pain? Okay. And I saw this video about the yoga thrust when people lean and they go forward, backward, and the guy just standing in the front, and she thought she had to go in the front, but she go in the back. You didn't see that? The person just smacked her. It's so funny. All right, so now the next one. It's same test for the spondylolisthesis, and we're gonna ask to bend on the side. You can place your hands on the heels, and what I'm doing, I just push gently. Any pain?
No.
Okay, and we're gonna go to the right. Not just bend. Is any pain here?
No.
Okay, great. So most of the time, people are gonna experience pain when they go in the back or weakness. And the next one, we're just gonna check L4, L5, and S1. We've already done this many times. We're going to ask the client walk on our heels. And see if any drop legs. Can you see the legs now? Mm-hmm. No, can you see the camera?
David,
Yeah.
Okay, let's give you a little bit ahead. Okay, so the next test, we want to check the L4, L5, and S1. And now we're going to walk on the heels. So this is like more S1, S2. And see if any legs more drop, any pain when you walk.
No.
Okay, in the back, you're going to walk on your toes. Just on the top. You can do backward, it's great. Is any pain up there?
No.
Oh, she's really great. I don't see any problems up here. Now, David is going to come up here. David, come up here. We're going to test you. Okay. So David, going to do the same Stork test.
Socks, I have socks.
Yeah, you're okay with socks, yeah. So we're going to check one leg first. Just going to stand up and stay. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. A little bit wobbling. Let's switch the leg. Any pain?
No.
Okay, good. How's it feel?
Good.
All right, and now we're going to do Stork test. You're going to drop it down, a little bit relaxed, shake it up, and place your hands on your heels. Left on the hip, lift your one leg and kind of lean backward. You see like a little bit wobbling up here, not stable, so that's kind of giving you some idea. Switch other leg. Any pain?
No.
This one is kind of more stable, so we have some. Do you feel anything like more like just?
Yeah, it was harder to balance on my left side. Yeah.
Okay, it's might be ankle problem, might be hip problem, so we have to work on that. It's what we're looking for. It's a pain. If this is no pain, this is great, and we're gonna start treating.